Hi, I'm Dr. Gary Motykie, and I'm a board-certified Beverly Hills plastic surgeon. And today we're going to be talking about Oli London. I think it should be Oli's soul. We're getting a lot of requests to talk about this particular patient who's undergone plastic surgery to look more Korean. Originally from London, his idol is Jimin, who is a BTS star, and he wants to look like him. And today I just wanted to go through some things to say, do you think this is a good idea, a bad idea? In general, most people that know me probably already know my opinion, which is I don't really think it's a great idea. I think, again, one of the golden rules in plastic surgery is to do surgery to look like a better version of yourself, but not somebody completely different. And whenever you're trying to do that, it doesn't always tend to work out very well. I think a lot of times the people end up looking strange or weird or like a lesser version of that idol that they have, and I just think that it's one of those things that probably should be avoided. I think you can do things to have some of the features of maybe somebody you like, but to necessarily change your entire face to look like a different race or a completely different human being, I don't necessarily think that's a good idea. So I thought one way to go through some of these topics about Oli London is that he actually did a video on a show called Hooked on the Look, which is about plastic surgery extremes and patients trying to look more extreme or different. In there, there are some topics we can discuss, and I think it's interesting that the first thing I see here is warning, contains medical images that some people may find upsetting. Again, that's not what you really want out of the world of plastic surgery. Hopefully they don't mean his face and they mean surgery or different things, but in general, plastic surgery is supposed to make you look like a better version of yourself and not something scary or upsetting. So let's jump in and take a look at the video.
I want my entire lifestyle to revolve around K-pop, and I want my entire look to look like Jimin, the lead singer of BTS, because for me he's perfection. I just kind of want to look like him.
He's not saying he wants one of Jimin's features. He literally wants to look like this person. I think some of the things he doesn't understand out of the gate is that trying to change your complete race and all of your facial features. There's other things besides just superficial anatomy, bony structure, different sorts of genetic hereditary traits that are just not going to translate perfectly when you're trying to do surgery. So I think trying to go that extreme, you're going to end up probably looking different and strange, but not necessarily another race.
I want to look like a K-pop star. I want my entire look to look like Jimin. He's honestly my K-pop idol. Yeah.
I don't want to say that it sounds necessarily immature, but I just think probably growing up we all have idols, we have different things, we probably want to look like, but does that necessarily you want to literally transform yourself into that person? I think that at some point somebody needs to ask some questions about that and why do you want to look like that person. It sounds like he was exposed to Korea and this culture, and that's fine. Some point you need to get checked a little bit and say, is this really a good idea? Something comes to mind I was thinking about, which is my social media manager. Even though he idolizes Britney Spears, I'm not sure he'd want to go through all the surgery to look like Britney Spears, right?
Correct.
So I think that it's fine to idolize people and their look, but then in reality, again, I think trying to literally become them, there may be a little bit of an identity crisis there, a personality. He seems to almost disassociate and want to be that person. There may be some sort of other things going on. A lot of patients don't want to be somebody else. There may have been something in their childhood or trauma or something they were exposed to. I'm not saying that happened to him. I'm just saying at some point you got to ask some questions like, why do you really want to be a BTS star, and what are you really getting out of this?
BTS debuted in 2013, and I was actually living in Korea at the time. So I was just amazed by all of them. They were perfect. Jimin is the lead vocalist. This is his current hairstyle at the moment. That's why I'm trying to replicate it. I want to be him, but I also have a crush on him. Like, to be honest, all K-pop stars are so beautiful.
But yeah, again, that's interesting, right? But crush on him and wants to be him, and there's just a lot of issues there. And in looking at him now, and again, I'm not critiquing him at all, but I think he's getting into surgery. But at this point, do we think he looks Korean, or does he look like a person from London trying to look Korean? I don't think he's quite made it there yet, so it's just one of those things where I just really worry about people that want to be something totally different.
These are some of my shoes. These ones, they're very, very, very striking, especially with the spikes. A lot of K-pop stars wear this.
I think dressing like that's fine.
Now these ones were expensive.
You can take the clothes off.
650, 700, 790. This one is my most expensive clothing item. It was 7,000. Now this one, I wear all the time. It's Roberto Cavalli.
Do to be able to afford
Jimin actually wore this in the Fake Love video.
No.
So I'm super obsessed. I wear it all the time. So yeah, this is very special to me because
cheap for all this stuff, let alone all the surgery.
I mean, the K-pop stars have so much pressure on them. Before they even become famous, they have to train for 4 years. They live together, they have to train 8 hours a day. It's all manufactured, the way they look, the way they perform. They all look incredibly perfect. And when I actually watch their videos, I cry just because they're so beautiful. That one is actually an original photo of me. I'm trying to think how long ago this was. Maybe like 7 years ago, 8 years ago. I was always like insecure because, to be honest, I had very bad acne when I was at school, and I had my nose was very big. That's when I actually decided, look, I need to change myself now and be a lot happier.
He's showing pictures of himself. His nose wasn't that big. I mean, again, there's some things where, I don't want to say body dysmorphia, but it sounds like, again, something in, he's worried about acne and different things in his childhood, and was he traumatized by something? I don't know. He's not a bad looking guy, to go so extreme. Are you going to look like a better version of yourself or really strange? I'm not sure what advice he's getting and how he's affording everything, but again, is it a question of, should he do it? Can he afford it? Who's taking advantage of him? Is he really happy? These are all questions we'll have to delve into as he moves along, but he's certainly obsessed with BTS and looking like Jimin, and again, for me, that's a big red flag. People coming in asking those sort of things. In this case, he may end up happy, but a lot of them do not end up being happy. They end up chasing and chasing and chasing, and eventually giving up or wanting to reverse it, and a lot of it is irreversible.
It's horrible. It's very hard to look at it. I don't even recognize the person. I just don't even seem to relate to this person. It's weird. I remember when I took the picture and everything, but it just doesn't seem like it was me. I had all of the...
That's what I mean by a little bit of almost disassociative, like he doesn't even recognize himself anymore. That's a place you can almost get lost, like who are you anymore? I'm not that person, I'm not this person. To me, it's just, that would be a very scary place to put yourself in. Who are you? You're not Jimin, and you're not that person. It just seems like a place that can get very lonely, scary, lost, and so that's why I don't advise it.
Fatty tissue removed from my chest, so you can still see I have the scars, and it's still very sore. I've also had a blepharoplasty, which basically was work on my eyelids for rhinoplasties, angle reduction, which is basically a jawline surgery. I also have a silicone chin implant here.
So just really quickly on that, I'll try not to stop this too many times, but a lot of the surgeries he's talking about are very popular in Korea right now. A lot of these facial reshaping surgeries. There are a lot of surgeries that started out as facial rejuvenation, in other words, to make patients look younger, a little better version of themselves, and now have morphed into these facial reshaping procedures where they're contouring the jaw lines and cheeks and faces, and he's already had multiple surgeries. And, he's admitting to it, which is good, so people know that he's not trying to say, oh, this just happened naturally. But multiple rhinoplasties already. You already see some scarring on his nose. He says scars on his chest. These things come with risks and comes with scars, and things that are irreversible. And again, at this point, even the upper blepharoplasty, which is an upper eyelid surgery, to me, it's a little confusing because it's the opposite of what he wants to do. For a Korean look, you want heavier upper eyelids, and now he went and did a blepharoplasty to make them less heavy. If anything, I think I might make it look a little more Caucasian, less Korean, so I'm not sure on that advice, but this is some of the things I'm talking about, making sure what is he really trying to achieve here, and is he really looking Korean or just different? Well, at least he didn't do a canthopexy and a brow lift, because that would make him look even stranger. Wait, I'm just kidding. So later on, after this surgery, he goes even more extreme, and more recently, did he go to Turkey?
Yeah.
Of course. He does more extreme surgeries to the brow and to his eyes, called the canthopexy, where the cat eye look and pulling the corner of the eye up as well as the lateral brow. And again, is that something that's necessarily going to make him look more Korean? Maybe a little bit of changing the eye shape, but the brow lifting and angle, again, is not going to give him a heavier brow. To me, it's more of the opposite effect. So I'm not even sure he's getting good advice on how to look more Korean, let alone doing all these extreme surgeries. Once again, I'm saying, why are these surgeons doing these surgeries? Do they really care about him and what he wants and trying to make his life better, or are they just trying to make some money? Korea, Turkey, two of the big places. Again, why are patients going there? I think a little bit of bargain shopping, but also secondly, a lot of marketing, advertising going into that, and much more lax regulations. So the less risk for the surgeons to be doing those surgeries, whereas in the United States, if you're doing things, there are certain standards of care, certain ethics, we're held to certain moral standards. You can jeopardize your license by doing things that are risky for patients or damaging patients. So I just think that's why we're seeing a lot of these patients go to these other countries. And I think the mass marketing is just insane. It's crazy. I will say again, one caveat, I know I've said multiple times, is a lot of times we'll see these patients early. We'll see them, you know, I think even in his video, it's right after surgery. We don't see them years later. What are the after effects of these sort of extreme surgeries? Unfortunately, the surgeons in the States or other places, we do see these patients come back after these extreme surgeries and they want it reversed, you know, after a certain amount of time. And unfortunately, a lot of times it is irreversible or very difficult to reverse and very expensive to reverse. So that's one of the reasons I like to go to these videos and inform patients, you know, watch out for this stuff, because once you do it, you want to change it, you may not be able to.
So yeah, probably about 75K in total just on the procedures.
75,000 pounds?
I'm going to see my doctor today about how she can make me look
Where's he getting all this money?
Jimin.
Do you think he's going to a plastic surgeon?
Yeah.
Like the shape of his face and also the eyes as well.
Because he's a Korean star, it's much more rounded than Caucasians' faces in general. There's more fat tissue.
Yeah, is there any way you could make my eyes look more like that kind of shape, like the almond
Yes,
shape?
that is doable.
One possibility.
Yeah.
Okay.
Cosmetics. Cosmetic surgeon.
Oh, this is actually the guy.
As I suspected, he's going to a cosmetic surgeon or non-plastic surgeon, which isn't necessarily a bad thing. He may be a dermatologist. But one of the things that she said, which is true, is that Korean faces are rounder and have more fat. So if anything, it seems to me the one thing you could do is fat grafting rather than fillers, right? And also overfilling these faces, doing strange things with these fillers. Again, it's not really, when you have a hammer, everything's a nail. So some of these places there, maybe a surgical procedure may have been a little less aggressive than trying to pump up the face full of different things. So patients tend to think, oh, fillers, it's fine, you know, it's not a big deal, but it does come with consequences. And a lot of these fillers stick around the face a lot longer than we think. A lot of the fillers can distort, stretch the skin, and also the procedure itself, if not done with an experienced hand, these fillers can be dangerous as far as if you get in a blood vessel, they can cause blindness, they can cause damage to the face. So again, it's something that don't take it too lightly when you're just going in for fillers or things. Make sure you go somewhere that's experienced.
Just so you can see the face shape. I just kind of want to look like him.
So we're gonna a little bit give you volume back on the cheek area, which is gonna a little bit help with your eye area. So it's gonna push it up a little bit.
Right, that sounds really good. Thank you, Doctor.
Good.
I don't know. I mean, it's not just adding volume. Where are you adding the volume? How are you adding volume? Is it, you know, there's a certain aesthetic sense here. Again, he's trying to make himself look more Korean, but I'm not sure what the doctor's saying there, and I'm not picking on this, I'm not saying anything, but lifting the eyes, doing these sort of things, adding more cheekbone volume, is that really more Korean? It's really one of those things where this is a big gray area, and again, looking at aesthetics, I'm not sure he's really interested in what may make this patient look better, more than just doing fillers in the face to try and make him look more Korean, which again, in the end, is not something that's probably going to work out super well. You can definitely mask some things and make some things look better, but I still think it will end up looking a little bit more like a British guy trying to look Korean from what I see here.
You don't know what you're doing, you can make people blind.
Yeah.
There you go.
Really? From this procedure?
Oh yeah.
Oh my God.
That is correct.
Oh God, you've given me the eyes. That is incredible.
Do you think he looks more Korean after that?
Yeah.
No.
Wow. Just changes the shape of my face as well.
That
And
was
this as
just
well
me.
looks incredible. can't move my face and smile right now, but I'm very happy.
I'm not picking on.
Wow. Honestly, but like this.
Bless your heart.
Thank honestly, Dr. Didar, you're the best. Thank you.
Bless
and
your
Jana,
heart. Let
honestly,
me take this off.
I want to look like a K-pop star, and they happen to be Korean. I just find them incredibly beautiful. I actually look Korean now.
Oh yeah.
I actually look
Say
Korean.
like that.
And you put the Korean injection in me, I feel Korean. Wow. That's right, Jimin. Well, I'm not exactly changing my race. Like, I'm not saying that I want to be Asian as such. I'm always going to be, British, Caucasian. But I would like to look as close as possible to Koreans, like Korean pop stars and Jimin.
I don't know. I'm not sure why, why doctors would do that. He's had 4 rhinoplasties?
Yeah.
Wow.
So nice to have a glass of champagne, right, guys? Celebrate, I know.
Oh, he's going to see his family?
They think I shouldn't change
Friends.
anything.
Friends.
But I'm extremely headstrong, so if I want to make a change, I will do it.
There's a lot of really headstrong patients and a lot of patients that need to be educated. I mean, just because you're headstrong, you want to do something, doesn't mean you shouldn't take expert advice. One of these doctors, even the one he just went to, maybe should say, well, I'm not sure that's really going to make you look better or more Korean. But that's the point of being a patient advocate and educating the patient and saying, hey, yeah, I can do this, but it may not do what you want, and you're going to be spending a lot of money, a lot of time. Thank God the fillers are only temporary, but the surgeries themselves, if they take his money and sort of take advantage of him, he's going to be left looking that way. And there'll be a lot of upkeep, trying to maintain that look for years and years and years.
So what do you guys think of the new look then? It's obviously very different. Like, what do you think?
The eyes it is taking me a little bit of time to adjust to actually because, yeah, it's...
Do you know it's still me? Do you feel like it's still me, or do I look more like Jimin?
I don't ever want to picture you like this pop star, to be honest.
Yeah.
You're upset?
A little bit, because I really...
You're upset as well?
Yeah.
I really just don't want you to get to a point where you can't undo anything. I mean...
We do support you, but...
I think fine, he's getting good advice, right? His family and friends are giving him advice, right? But he's not really listening. But at least they're trying, right? And it's similar with the doctors. The patient may not listen, but at least try. Try to, talk to them and give them some advice. So I like that his, family or friends are trying to talk.
But just concerned, we do want the best for you. And
Thank you, Kofi. Thank you.
It's a tough place, being supportive, but
not.
that's tough.
I think we're past that, Oli.
You think I'm addicted?
Do you not think you're addicted?
I don't think I've done that much, but it's just I want the perfect face. I don't think it's an addiction. I just think it's I have a strong interest in pursuing my goal.
I think one of the things he says is there is, I'm trying to get the perfect face, and again, I'm warning patients. Even Jimin or BTS, they're wearing makeup and filters and different, and they are Korean. Trying to chase that perfection, that's where things go sideways and things can go terribly wrong, I think. And again, that's a lot of stuff that's out there in the media with social media and filters and chasing after their idols. And in reality, a lot of these people don't look the way they look when they're not filtered and not on social media. Perfection is the enemy of good or pretty. In other words, while trying to chase that perfection, you may spill into not pretty and not good looking and not good results. And so there has to be some balance there and some guards on, rails on that road, because if not, it's easy to crash. So I think that I like the fact that his family and friends are giving him good advice, and I think hopefully some doctors are as well trying to give him some good advice to maybe say no, or these things may not achieve what you want out of surgery.
I've never heard of anyone doing this eyes.
Really? It's a very common thing in Korea.
Yeah, in Korea.
I know. We're in London.
We're not in Korea.
I know, but I'm obsessed with Korea. I know, both of you. I know you're actually...
I don't want you to start looking.
Isn't it?
I know.
To Kendall. That's my...
Ken dolls are a whole nother...
I want to look Korean.
I think it's interesting because everybody in Korea is trying to look Caucasian, and he's trying to go the other way. It's a weird thing, right? So a lot of the surgeries they're doing there are to narrow the faces, look more Caucasian. In fact, the upper eyelid surgery to go the other way is a little easier, so it's it's interesting that he's trying to go the other direction. In Korea, it's very extreme surgeries, very strong marketing. All these surgeries necessary, or I think there is some of this spilling over into America and the world, seeing these extreme surgeries and wanting them, but not realizing some of the risks and complications that come along with some of those extreme surgeries.
I look a little bit, you think I look like Jimin a little bit? Like,
oh, yeah, I think so. Your makeup is more,
like,
I think a little over.
Oh, maybe too much makeup for Jimin.
Yeah,
okay. The next thing that I'm going to do is I want, again, a revision rhinoplasty to make my nose a lot smaller, a lot narrower. I want to get a lateral canthoplasty.
I wonder where he's going to go for that.
Incisions here and kind of cutting this out and then moving it across just to make the eyes more of an almond shape. So I don't want to look like a normal person. I want to look like a kind of superhuman kind of K-pop doll, just like Jimin. So yeah.
Wow. So wait, so he's saying he wants to even look more super K-pop than even Jimin? I mean, it's like, yeah. I mean, you're getting dangerous here again. 4, 5, 6, 7 rhinoplasties. Things are, the risks are starting to add up a little bit with these surgeries. And now he's wanting to, as we talked about, completely change his eye shape, do the brow and the cat eye, and again, some of those things may look okay. Is it really towards achieving his goal? I'm not quite sure. And I think once you hear words like perfection and the perfect K-pop doll and the Ken doll, we're starting to, for me, it's very skittish because, these things aren't realistic. They're things that, is this patient gonna end up happy or just want more and more and more and more and more and more and more? So a lot of warning signs there and a lot of red flags. And I'm not picking on him personally. He's a human being and he has the right to do what he wants. I'm just saying, in your own mind, when you're hearing these things, and as a surgeon, you start to worry, maybe something else is going on here. And maybe it's something, the advice would be, maybe don't do more surgery, do less. So I just hope you get some of that advice, even if it's not after this surgery, but at some point, because where do you stop?